In IVF, we are going to give injections and we are going to do scans from your maybe 5th or 6th day on alternate days, and we are going to see follicles in that. We can't see eggs. The follicle size we are going to measure and we'll decide what is the dose of injection that is required, and we'll tell you if it is normal growing, slow growing or fast growing. Sometimes we get very less number. We may be expecting 50-20 eggs, but we may end up with 3 or 4 eggs, and the quality of those eggs also will be very bad, or they can have only a shell of the egg. Inside the cytoplasm, nothing will be there. Husband semen analysis is very easy. They can give the sample, we can analyze under the microscope and tell you what is right, what not is right. But for the female parameters, it is very difficult. Only through the process of IVF, we can know what is your egg number, quality and maturity. So all these are fine, there are good chances of conception. If there is empty follicle syndrome, there is no eggs, or the quality is very bad, then we won't be able to get a good embryos. So all these are different things we will know only in IVF process. Through the process, there is no parameter or there is no test to check all these things prior. And AMH is what it tells the number of follicles that is there. Your egg reserve is there. What is the quality of your egg, we won't know, and it's definitely not a measure of the quality. Only in IVF process, after the egg pickup, we can say what is it. Before that, it is impossible to say how your egg quality or whether you have eggs or not. To say that, it is not possible. Hi, myself Dr. Chaithra, fertility consultant working at Shishu IVF Fertility, Rajajinagar. In IVF, we are going to give injections and we are going to do scans from your maybe 5th or 6th day on alternate days, and we are going to see follicles in that. We can't see eggs. The follicle size we are going to measure and we'll decide what is the dose of injection that is required, and we'll tell you if it is normal growing, slow growing or fast growing. That doesn't mean we know what is the quality of egg that is inside. Whether every follicle has an egg or not, we won't know until the day of ovum pickup, egg retrieval day. So that day we are going to prick all the follicles, we are going to take out the fluid from that and we are going to see under the microscope. So what are the various scenarios that we can come across on that day? Everything may be normal, your quality of eggs are good, okay, fine. Or other things are, sometimes we may not get any egg at all, okay. So that is sometime the trigger, means for the maturation we would have given some injection, it may not have worked, okay. So that may be one of the reasons. But most probably, especially in unexplained infertility, means in scan your egg reserve is good, follicles are looking good, husband parameters are fine, but still you have not been able to conceive for very long time. In that case, maybe there is something called empty follicle syndrome. That means the follicles are there, everything has grown to good size, but when we pick it, no eggs will be there. So this is one of the syndrome, that is empty follicle syndrome. We won't retrieve any eggs, so we will have to go for other options for conception. And what are the other things we can see? Sometimes we get very less number. We may be expecting 50-20 eggs, but we may end up with 3 or 4 eggs, and the quality of those eggs also will be very bad, or they can have only a shell of the egg. Inside the cytoplasm, nothing will be there. These are the various things. So patient's common question is, Madam, you should have known this before only, you could have explained this to me before, then I wouldn't have gone for this procedure. No, see, husband semen analysis is very easy. They can give the sample, we can analyze under the microscope and tell you what is right, what not is right. But for the female parameters, it is very difficult. Only through the process of IVF, we can know what is your egg number, quality and maturity. So all these are fine, there are good chances of conception. If there is empty follicle syndrome, there is no eggs, or the quality is very bad, then we won't be able to get a good embryos. So all these are different things we will know only in IVF process. Through the process, there is no parameter or there is no test to check all these things prior. And AMH is what it tells the number of follicles that is there. Your egg reserve is there. What is the quality of your egg, we won't know, and it's definitely not a measure of the quality. They may say, okay, my AMH is 2.5, 3 or whatever it is, so I have good reserve. Yes, you have good reserve, but what is the quality of your egg is an entirely different matter. Only in IVF process, after the egg pickup, we can say what is it. Before that, it is impossible to say how your egg quality or whether you have eggs or not. To say that, it is not possible.